Alright, so my name is Ashley. This is my IPPE rotation. I'm from the University of Minnesota Duluth Pharmacy School, and I just finished my first year.
Hi, my name is Jeremy. I'm the pharmacy supervisor, so one of the pharmacists here at the Allina Health Cambridge Pharmacy in Cambridge.
My name's Jake. I just started my 4th year pharmacy school rotations. I also go to the University of Minnesota Duluth.
So you're all in different places in pharmacy then, huh?
Absolutely, yeah. I kind of got a nice variety here.
So Ashley, let's start with you.
Okay.
So if you want to tell Anoka Ramsey students kind of where you are in your pharmacy path and how that's going.
Okay, so I'm kind of new to pharmacy. I didn't have any pharmacy experience before I started pharmacy school, and I recently started working at an inpatient pharmacy up in Duluth by where I go to school. So I'm just now starting to get a feel for the retail setting, so this IPPE is giving me a good chance to see how the retail setting goes.
So since you've been in retail, how's it been, like a few months or a year or so?
No, just this first week.
Oh.
Yeah, just on this rotation. I haven't had any community experience so far.
So how are you liking the retail setting? Is it pretty different than what you're accustomed to?
Yeah, it's a lot different. Like in inpatient, we don't get any patient contact at all, so we just fill prescriptions that the pharmacists have already checked. So here it's a lot different, and the flow is a lot different than what I'm used to. But it's nice, fast paced, which I like.
Okay. So is Jeremy teaching you any customer service skills?
I think so. I can tell that he has a lot of good communication skills, so I'm trying to pick up on those.
Okay.
Best I can.
So Jeremy, you want to tell us a little bit about how your experience has been as a supervisor here?
Yeah, absolutely. So I've been out of college for a little while. I won't share how many years necessarily, but my experience here has been wonderful. I've had a variety of experiences in my past, and I came to Allina almost 4 years ago, and was afforded this great opportunity to come here and work with a really great team. It's a little bit of a different environment for me. I haven't worked in a health system like this before, as far as the retail setting goes. So for me, the opportunities that come along with that have really been rewarding. You know, I get to do things as a pharmacist that a lot of times clinical pharmacists or hospital pharmacists only get to do. But in this type of setting, you know, some of my work is a little bit blended, so I get feel like the best of both worlds.
Nice. So you're next. Do you have any memorable aspects that's happened to you in the? How long have you been here? A couple months.
I've been at this site for this is my 2nd week.
Oh, okay. So you and Ashley on the same deal.
Yeah, I've worked in retail pharmacy since undergrad. I started working as a technician.
Okay.
And then I work for Walmart as an intern now. So it's definitely a different feel at Allina when you're part of the health system like Jeremy was talking about. Just you get different scenarios and more information and just kind of different patient encounters. A lot of it's similar as other retail pharmacies, but kind of unique, just the different setting you get. And kind of the communication with the providers here is kind of a nice change, I guess. It's better access to providers. It's kind of a unique setting.
So then, this is your 4th year in pharmacy school,
Yeah,
correct?
so I just finished my 3rd year, so I'm done with all my classes. Now I just have...
Congrats!
It feels good.
Right.
Yeah, so I just have my last year's, all of my rotations, so...
So during school, were there any key things that you want to share with maybe students that are interested in going to pharmacy school, like any skills that they need to obtain before they get there or anything like that?
Yep, so to me, pharmacy school was a lot at first. Undergrad, I kind of felt was pretty laid back compared to pharmacy school. I think time management is one enormous thing. Getting work-life balance is a big part of it. It's balancing school with all that too. I didn't start working right away when I started school just because of the time barriers. I'm married as well, so that was probably the biggest thing was balancing school and my personal life. So I think if just having the ability to manage that and being able to prioritize things is going to be a big, for anyone looking to go to pharmacy school, that's going to be a big thing to get used to.
And then you were just talking about in your, what was it, a couple months ago, you just had to present your research. So how was that experience?
So Personally, I'm not normally a big fan of presentations. I get a little anxious when I'm standing in front of a classroom full of faculty and
intellectuals.
Students. Yeah, yeah. So that's kind of what pharmacy school kind of throws a lot of different things at you. You have to be able to kind of talk in a small group setting and be able to present to that, but you also have to be able to kind of communicate in front of a larger group of people, which can be challenging depending on people, depending on the different preferences that people have for what they're comfortable with.
And Ashley, have you had a similar experience? How long have you been in pharmacy school?
I just finished my first year of classes.
Okay, so you're pretty early on.
Yeah, exactly.
So how was your first survival?
It was good. I would say a big part of it is like forming relationships with your classmates, because I really don't think I'd be able to survive pharmacy school without the people around me, because like you really need their support and everything to kind of get through and understand the concepts too. So that was a big part of it.
So what are some of the things that they supported you with? Was it, getting the notes from another class that they took, or how did they support you?
I would say just understanding concepts. So if I didn't understand something, I always felt comfortable going to them, and they were more than happy to like tell me a resource that they used, or even like give me their notes, or like study aids that they had used. So that was really helpful. And then if I ever missed class, just getting notes from them or things like that. So that was really helpful for me.
And so, Jeremy, looking back on pharmacy school, were there any things that you would tell students to do that you probably forgot to do when you were in pharmacy school?
I don't know. I mean, looking back at it, I think, and these guys would probably agree. I mean, you have to definitely be committed. It's a big undertaking, but it's very, very worth it. I guess one advice that I would have is it's very competitive. And for anybody that's especially trying to get into pharmacy school, there can be a lot of pressure on that. But I think just remembering to relax, to enjoy your time, because even though when you're going through it, it feels like it's taking so long, and I've been in school for so long.
Yeah.
And, all these classes, it can seem pretty daunting, but at the end of the day, it goes really fast. And even I think about my time since I've been in pharmacy school, and that time has gone really fast. So I guess I would tell people just to enjoy it as much as they can. And I know Jake had talked about proper like school life balance. I think it's pretty easy to get caught up. Just going to a room every night and studying, opening a book, and doing this and that. But it's important to go out and enjoy life a little bit too, and maintain some hobbies and to do some things that maybe stimulate your mind in other ways than the coursework.
So what are some ways that you probably learned after your 4 or 5 years in pharmacy school that help you with that work-life balance?
So for me, I really enjoy athletics. I played a lot of basketball when I was in high school. So when I got to college, it was finding an intramural team. It was finding city league stuff, things where physically I could be active. I mean, obviously it was pretty mentally draining. But getting the opportunity to go out and do something physical and maybe taking my mind off it, and then I just think Ashley talked about relationships, but I was fortunate. I developed some really great relationships, both pre-pharmacy and once I got into the program, where we could go out at night we could vent because we all knew what we were talking about. Sometimes if you go out with some friends that maybe are studying something different, they don't have the same experiences as coursework goes, so you could go and you could vent about this was really stressful, or this was tough, or there's a lot going on right now, and I think that was something that, looking back, I really valued, and I'm glad that I did, and maybe even wish I did more of.
Yeah, I would agree with that. Having friends in your class that are going through the exact same thing, it makes it easier to vent for one, and just someone that gets it and understands what you're going through, because it is different than anything else. Like pharmacy school is kind of its own unique beast, so it's can be a lot. But I wish I would have kind of embraced spending more time with my pharmacy school friends earlier on, rather than, because the time does go by crazy fast. You're so busy, it's just like it goes by before you know it.
Yeah. So now that all of you are working in the industry, do you believe that work-life balance is also important now, same as in school?
Yeah, definitely. I feel like I've only been not had classes for like almost 2 weeks now, and I feel like I have so much every time.
Yeah.
It's very strange.
Mhm.
Yeah, because during school, it's I go to school, I go to work, and then I go home and sleep essentially, and there just isn't a whole lot of time to balance. But now it's I head home after I'm done here, and I have free time to just do things I enjoy and spend time with friends and family.
And I would say much the same. I mean, when I got out of pharmacy school, it was really eye-opening how much free time there really was.
Yeah.
You almost don't know what to do with yourself. And I think I know it's tempting for students, especially coming out of school, if you've got a lot of student loan debt, things that maybe are weighing on you a little bit, where you feel like, oh, I have to work all these extra hours, or do those kind of things. And in some situations, I think that's perfectly normal. I think that's acceptable, and if that's what you feel like you need to do, great. But I do think there's the opportunity to take the time and to enjoy what you've accomplished a little bit, because it truly is, for anybody that graduates with any sort of degree, it's an accomplishment, and I think you should take the time to enjoy that.
And Ashley, since you just finished your first year, now that you're in the summer, are you feeling like you don't have much to do, or?
I mean, we still have like little assignments here and there, just like for this rotation that we're on, but it's nothing compared to what we had like the last semester. So it really is like, oh, I can finally breathe and like relax a little bit. So I definitely feel a lot less stressed right now, and I'm looking forward to being able to work this summer and kind of get more experience in the field. So I'm excited.
So then, now that you guys are interning here, so what are some of the things that you're learning about pharmaceuticals and stuff like that?
I guess I
So in school you learn a lot about, you learn the mechanism of action for all the drugs. You understand the pharmacology behind them and all the science, where the things you learn in pharmacy school and real life, there's a difference. I'm really happy I was able to work during school a lot to get that experience, because I feel like I learn as much at work, if not more, than you do in school, just being able to apply the stuff you're actually learning. Because I think that's the most difficult thing, is being able to, you have this, every pharmacy student has this like great depth of knowledge on how all the drugs work and everything like that, and everything that goes into it, but then being able to actually apply it, I think that's where it can be challenging. So that's kind of the most important thing I get from working, is just, you know it, but now being able to actually use it.
So then what would you say is challenging about trying to apply it? Is it just trying to remember all of those terms and then being able to spit it out on the spot?
I mean, in that, and just kind of taking each patient as their own unique, like every patient is going to be their own unique scenario. It's not like you can apply everything you learn in school to every patient. It's going to greatly depend on, the patient's individual factors that make them unique, which everybody is. So that kind of makes it the most challenging, is just taking each patient, case by case, and kind of seeing how to apply what you know.
And then Ashley, how's your experience been?
It's been really good. So since I haven't had any community experience, it's been nice to just see like how this pharmacy runs and everything that goes into it, like even like how much the technicians do, and then like how they have different pharmacists doing different checks. So that's been really nice. And then we also had like a conversation the other day about like the business side of things, which is something that I don't really know a lot about. So it was nice to kind of go over like the finances and what goes into buying and all that different kind of stuff. So that was really interesting for me.
So what's kind of maybe just a couple aspects of the business part of pharmacy, because I'm totally unaware either.
So we went over like the buying type of stuff and like what goes into like I guess the overall budget, so like different like salaries and all that kind of stuff. So I guess it was stuff that I didn't really think about, and then about how like pharmacy, there isn't a lot of room for like profit really, just because the drug prices are so high. So just looking at that and stuff.
So, and then Jeremy, if you want to speak a little bit about kind of the different experience you had with the different, would it be industries within pharmacy?
Yeah. So prior to coming to Allina, I was fortunate that I had a few different experiences. Some were at more independent type retail pharmacy, where it was a single owner. smaller community. I've also worked for a large chain, and that's really where the bulk of my recent experience came. A lot of similarities, of course. You know, at the end of the day, pharmacy is still pharmacy, and we're still here to provide a service and take care of our patients and make sure that, you know, safety is something that we're providing. For me, one of the bigger things that I noticed when I was working for a little bit of a larger corporation is oftentimes the leadership that I was interacting with may not have had a lot of pharmacy or healthcare experience. So there were definitely instances where I had the opportunity to do some educating and to teach them a little bit about what pharmacy was all about and even healthcare in general. So, you know, there was a lot of back and forth as they were teaching me about, you know, leadership and how to run a business and things along those lines. I was able to also teach them a little bit about the healthcare aspect. Coming to a health system, very different. Obviously, a lot of the leaders that we have in place are healthcare providers, whether it's physicians or nurses or in our pyramid, obviously pharmacists. So the benefit that we have is going all the way up through our senior leadership. Everybody's a pharmacist. So when pharmacy decisions are made, I feel great knowing that they've worked in a pharmacy, they have the experience, they know how that's going to impact the team, how it's going to impact the patient. So for me, I think those are the biggest things that I've noticed as I've kind of gone along in my career.
So would you say with the different industries in pharmacy, is it just kind of your personality and how it will fit in that industry, or does it have
I think so.
appeal?
Yeah, you know, I think obviously retail, you know, we're out front. Patients have a lot of access to us. So if you're somebody that is very outgoing, you enjoy patient interaction, you enjoy the conversation, you enjoy that piece of it, you know, I think retail can be very rewarding. You know, typically on the hospital side or on the clinical side of things, it's patient interaction, but yet very different. You know, sometimes it's indirect patient interaction where you're providing a service, but it's going through a nursing team or, you know, through a physician. You know, if you're in a clinical type scenario, you might have some very different interactions. I know within Allina, some of the clinical pharmacists do house calls, and they will actually go and sit down with the patient at their home and talk through their medications and make sure that you know, everything looks appropriate. There's industry, so if you're somebody that's really interested in the chemistry and the science, you can work for a drug manufacturer and you can be part of, you know, developing the next great medication or having an impact that way. So yeah, I really do think it's where your interest lies and maybe where you feel like your skill set is the strongest.
And when you say house calls, would you say, is that because it's a smaller community that happens, or?
So I think in a lot of instances, you know, for some of our patients, mobility is a little bit of a challenge. So whether it's physical limitations, where it's not easy for them maybe to make a trip to somewhere. I think sometimes it's financial limitations. You know, maybe they don't have the means, they don't have a car, they don't have somebody that can give them a ride. So I think it's an opportunity to still ensure that those patients are being taken care of, that we're able to provide pharmacy services. We're just doing it in a different setting. We're going right to the patient.
Okay. And then the final question I have for all of you is, do you have any tips on, for students looking to apply to pharmacy school, any tips on how to get in, maybe a better school for certain people or the easier school, you know, any of those tips? So we could start with,
I would highly recommend just getting experience in pharmacy. I think that, I mean, it's good to see that if you're applying to pharmacy school, they want to see that you actually are committed to the field. It's a big thing to undertake, like it's a big financial commitment and time commitment, so if it's not something you're certain you're interested in, I would definitely make sure that you get plenty of experience. Because the pharmacy, the people that look to accept people into pharmacy school, the people that are on the admissions boards and things like that, they want to see that people are committed to it. So yeah, I would highly recommend getting experience, whether that means working as a technician or just shadowing pharmacists in different settings or anything like that, just to get your foot in the door and kind of learn what the field's all about.
And are students able to do that if they're not in pharmacy school? Can they do that when they're in undergrad or grad school or something like that?
In just terms of getting experience?
Yeah, like maybe interning or like working at Walmart's pharmacy or something.
Yep, so to be an intern, you have to, in Minnesota, you have to have completed your first year of pharmacy school, but in terms of just becoming a technician or just even shadowing, just reach out to local pharmacies or pharmacists. A lot of times I think hospitals are pretty good at doing that. I know I was able to do that when I was an undergrad. You can just reach out to a hospital and kind of see what they're needing, and sometimes you can talk to a pharmacist that'll let you shadow and kind of just get a feel for what the pharmacist does a bit.
Okay. And then Jeremy, did you have any tips for students?
I mean, I think what Jake said is spot on. You know, I think showing some of that initiative, some of that drive. From my perspective, you know, anytime that you can demonstrate leadership ability of any kind. So whether you intentionally are planning on it or not, someday when you become a pharmacist, you're leading a group of people. You know, even if you're not a supervisor or a manager, there's going to be times where you're working with technicians, you're working with other pharmacists, whatever it takes to get the job done. So I think anytime that you can demonstrate, you know, a willingness or an ability to lead in any sort of capacity, I think that shows really well, especially when you're going through an interview process and trying to get into a program.
And Ashley, did you have any tips?
I guess kind of what those two just said, but also I think for me, having a good personal statement was really important, because a lot of pharmacy schools have you write like a personal statement so they get to know you just more than just the application that you're filling out, which can be kind of generic, and they see kind of the same things over and over. So letting them see like who you are before they meet you, so that you can get an interview, really helped me. So I guess that really helped.
So was there anything that you put on your statement that helped you stand out, like maybe you play volleyball or something like that?
I think mine was more tailored to like why I wanted to be in pharmacy school. So I've had people in my life that struggle with addiction, so I talked about like my experience with that and why it makes me want to be a pharmacist. And I think that really helped, and it showed that I had like a passion for why I want to be a pharmacist.
Great. So did anybody have any last minute things they wanted to tell students at all?
I think the biggest thing for me is, you know, for any students that are interested either in a technician career or a pharmacist career, don't be afraid to reach out and ask questions. You know, I think anybody either in the profession or going through school right now would be more than willing to help in any way that we can, because we obviously know what it takes and how overwhelming it can feel at times. So help from anywhere, you know, can be pretty valuable. So please don't hesitate to reach out.
All right. Well, thank you all so much for taking the time out.
Yeah, thank you.
Thank you.